I am Bethany Menimbo, Marketing Outreach Manager for the Office of Procurement, and I'll be your host for today's last session on Health and Human Services. Our next session is a presentation from our Health and Human Services Department. You'll hear a brief presentation, and then we'll have a question and answer session afterwards. Please type your questions in the chat box. The most common questions may be shared with the entire meeting. We may not be able to answer all of your questions in this session today. However, we will post answers to your questions on our website as soon as possible. Now I'd like to introduce IJ from the Health and Human Services Department. Thank you.
Hi, everyone. Thank you very much for joining us here today. My name is IJ Oji. I work for HHS, and I oversee our contracts management team here with a wonderful group of individuals. There are about 10, 11 of us who oversee all of the 700 plus contracts within HHS. So happy to be back here again for our annual virtual procurement there. Next slide, please. So just sharing briefly, our very proud mission. The department's mission is to promote and to ensure the health and safety of the residents of Montgomery County, and of course, to build individual and family strength and self-sufficiency. Next slide, please. And then I'll just speak very briefly about the types of programs and services within HHS. And so we're showing you our organizational chart. We're proudly led by Dr. Raymond Crowell, and under him are some magnificent chiefs who oversee our core service areas, which are children, youth, and family services. Currently now we have Oscar, who is our acting chief. Then we have Age and Disability Services. Odile Brunetto is our chief there. We have Behavioral Health Crisis Services. That's our chief there is Tor Rolando Santiago. And then Public Health Services, another core area. Our chief there, well, acting chief right now is Dr. James Bridges. Then we have Services to End and Prevent Homelessness, and Amanda Harris is the chief over there. My team falls under the Office of the Chief Operating Officer, and under her, Vicki Buckland is our COO, and under her we have budget, we have compliance, my team, the fiscal team within HHS, and our facilities, IT, operations, et cetera. And of course, you have the other section under Dr. Crowell, where you have, HR, human capital, employee relations training, et cetera. And then obviously, not to forget, we also have some other chiefs under Raymond. We have our Office of Community Affairs, and that's led by Betty Lamb. She's our chief there. Then we have the other sections for planning and accountability, and our legislative coordination and intergovernmental relations, and that's led by Leslie Xray. Oh, policy and risk management. How could we leave that? They oversee all of our HIPAA, risk analysis, and they help us review all of our MOU documents, and that's led by Joy Page. Next slide, please. So anyone interested in working with HHS and helping us carry out our much needed programs and services, you can find all of our informals posted on that link here, and also so our informals and our opens, and of course you can also go to the procurement website to see any of the HHS solicitations that are currently posted over there as well. Like all the other speakers will say, and like John, if you listened into John's session earlier, HHS similarly, we're looking for vendors who have the skills, the capacity, the knowledge. Obviously, being financially stable is helpful. We need you to have a proven track record in the service that you are requesting to be a vendor for HHS and for the county. And then, just being fair and reasonable with the cost. Certainly in this day and age, that is important as well. So we look at all those when we're reviewing the applications that come our way. Next slide, please. So HHS, we don't really have a lot of solicitations, right? Just joking about that. So we have quite a handful right now that are in procurement, either still being reviewed, and we're still working on internally. So I'll take some time just to go over those, and certainly welcome your questions as we go through some of our plans, some of ideas for the upcoming fiscal year, and some of that we're looking to post as soon as possible for the needed services. So we're starting with our behavioral health section. And what we have here is a child stabilization, oops, pardon me. Sorry, dropped my tablet. Okay. Hopefully that didn't affect anything. I think I'm still live. Okay. So our child stabilization service, this one is a new RFP for an existing program for a 24/7 program of intensive in-home services for the care for youth, adolescents, and transitional age youth from age 4 to 21 with serious emotional and behavioral challenges. So this is an existing program, as I mentioned, within HHS, and it's been with us since 2015. The incumbent is Family Services. Our next is our intensive outpatient and/or outpatient substance use treatment service. This one is an open solicitation, and we're seeking qualified and licensed entities and individuals to provide community-based level 2.1 intensive outpatient and/or level 1 outpatient substance abuse disorder treatment services to our adult Montgomery County residents and their families who might otherwise not have access to the services due to the limited health benefits or other socioeconomic factors. As I mentioned, this one is an existing program within HHS. So for this program, the services must include assessment services, individualized treatment plan, case management services, family services, a 24-hour on-call responder for client crisis services, and the ability to provide same day or next day appointments to our clients. Our next is psychiatric services for our open. And this one, the county is seeking applications from experienced and qualified psychiatrists and psychiatric professionals to provide a variety of psychiatric services for adults, seniors, children, and adolescents at various county facilities as assigned by the county. This will replace currently issued open solicitations, and the existing providers under the solicitations are welcome to apply. Our next is pharmaceutical services. Our next is pharmaceutical services. This will be a new solicitation for FY22, and we're looking to possibly bridge a contract. The county requires psychotropic drugs for low-income uninsured clients who are treated at outpatient sites throughout Montgomery County. And the current may seek to do an IFB or a bridge for these services. Okay, I think that's it for our behavioral health solicitations that we're looking for in the upcoming fiscal year. Our next will be for our service area of public health. And for public health, for the first one, we have gown laundering services. Did we skip a slide for public health? Can you go back one, please? Yes, we did. So for public health, the first we have there is our medical waste pickup and disposal services. This will be an informal service there. An informal solicitation. Then our next is dental supplies, dental equipment repair. This one, we have an incumbent for this, and this is Benko, where we're looking to resolicit this one for an IFP new solicitation. Then we have, next slide, please. Then we have our gown laundering service. This one is brand new for us, and we're looking for a vendor to provide us services to launder our gowns at our dental facilities. This is an invitation for bid. As I mentioned, this is brand new for us. We have another informal, the Xray reading and interpretation services. Let me have to look at my notes for this one, because I believe this one we're currently working on a draft. We're looking to submit this one as soon as possible. This is the Xray reading and interpretation services as needed for our patients in the TB program. So we're currently working on this one to be submitted to the Office of Procurement as soon as possible. The next one is our portable infant play yards and related sleep safety supply. This one is currently posted, I believe, and it closes on the 13th of January. So if anyone is interested, please do so now, since this one is currently posted. Our next is our courier and cargo services. This one, we are still working on it, so we haven't quite sent it over to procurement, but we are expecting for services as soon as approved by procurement. The incumbent for this one is Sun Technical Services, so it is an existing service. So here's courier cargo services, including pickup and delivery of our lab specimens. Our next is an existing service, but we are looking to do a new RFP, and we're looking to combine the two existing scopes, the two existing services into one RFP, two scopes here. So this is for the primary medical healthcare service for children enrolled at the 4 school-based health wellness centers. Our current incumbent for this one is Catholic Universities, and then for the second program is Children Pediatric Associates. So again, we'll do one RFP, but this time combine the two scopes into one RFP. Next slide, please. The next services here fall under our community affairs and our director's office. I believe the first one is our random moment time study RFP. This one is currently in procurement, waiting to be processed, and I know that we are excited to have this one on the ground. Out there on the streets for vendors who are eager to apply for this contract. Our next is our health promoters. The human services provider to develop and implement a program of outreach and education to our Latino population. This is an informal. And then we have the Human and Social Services Program. I believe this one already closed, but we're looking to have another one out there. And then we have our Welcome Center program. This is brand new for us. This is an informal as well. And then we have a couple that aren't on the slide, but I think that they're important to mention. And we have, so I'm referring to our African American Health Program. And for this, we're looking for, and these two that I'm about to talk about are currently at procurement waiting to be processed. But for the African American Health Program, we're looking for responsible and experienced service providers, organizations, entities to provide evidence-based health and wellness education services to assist the Asian Americans to live healthier and more holistic lives. Again, this is an RFP waiting to be processed. Another that is at procurement waiting to be processed also is our multilingual health navigation telephone line and interpretation service. We have a current contract here, but we're looking again to resolicit this one. And I believe that is it for this service area. Second, while I advance my slide on this side. Our next service area is services to end and prevent homelessness. We have a few RFPs that we're still working on internally in this period that we have now with COVID pandemic. Our shelters have been overwhelmed with services. We're looking to expand our service. We're moving to a brand new location actually that will be open effective January 1st. So the staff within services to end and prevent homelessness have just been incredibly busy. So we're looking to get out these RFPs as soon as the staff have had some time to dig back into working on the drafts. But for the first one, which is our homeless outreach service, actually, I think we skipped one that might be in the prior slide. That prior slide mentions our transitional housing. The incumbent for that is Catholic Charities at Washington, right? And I mentioned that one is our transitional housing. We are working on the draft right now to send to procurement. Next slide, please. And then the second one is our homeless outreach services for our homeless population. Another RFP that we're looking to send to procurement as soon as possible. The current incumbent for that one is EveryMind. I believe for these, because of the amount of work that the staff have been doing internally, we have asked procurement to work with us to extend these beyond the term. And I believe these have been extended beyond the term for the second time, but we are eagerly working on the draft so that we can put these back out on the street. Interface work is our next one for our rapid rehousing. My slides aren't matching. But yeah, this is another RFP also that we are working on internally, but the rapid rehousing services is for young adults who had their households and have dependent children. Then the next is providing a shelter and other homeless prevention services. This one includes case management services as well. Another request for RFP that we are working on internally to send to procurement. So as you can see, we're going to be keeping procurement very busy with all of our solicitations, those that are that they're working on their procurement, waiting to post them, and then the ones that we're still working on our draft internally here. Our next service area is aging and disabilities. Aging and disabilities, incredibly busy right now, same as all our other service areas. We have aging and disabilities, and then public health and services to end and prevent homelessness. But aging and disabilities has a number of solicitations that are either waiting to be posted or that we're still working on internally. So I'll talk about those briefly. So our first one is our medical supplies and durable medical equipment. This is an there we go. This is an IFB. I believe this one was already submitted to procurement, so we're looking for this one to be awarded as soon as possible. The next one is our operation of full service home delivery meals. This one is an open solicitation, and this one is in procurement right now, waiting to be processed. I believe we have extended this one for about the third time, I think. So this is another one that we're eager to resource it. Our next is providers of, I'm sorry, can you advance slide, please? Thank you. Our next is our providers of meals to seniors in adult daycare. We've submitted this one to procurement as well. This was just the first extension beyond the term. Our next is providers of culturally appropriate meals for seniors. This one we are still working on internally, so it hasn't quite made it to procurement just yet. But we are looking for this to be out there as soon as we can put everything together and send a good draft to procurement for their review. Our next is our respite services. This was submitted already to procurement, so we're waiting for them to complete their review and put it out there on the street. Our next one is grocery shopping for our seniors program. We are working on a draft for this RFP to send over to procurement. But this is another one that we would like to get started as soon as we're able to get it out there and get procurement approval. Our next one is the representative payee services for elderly and disabled adults. I believe this one was sent to procurement also, so we're just waiting for this one to be reviewed and approved and posted. Next one, we have our home care services, and this was submitted to procurement. This is another RFP, just waiting for this one to be reviewed, approved, and posted. Next slide, please. And then we have our state health insurance assistance program. This one provides both seniors and adults under 65 who have long-term disabilities with health insurance and counseling, enrollment guidance, and assisting them with problem solving, all of their health care, and ways to apply for these. And I believe this was already submitted also to procurement, and we're waiting for their review so that it be posted. Yeah, Aging and Disability Services is not busy at all. Our next is our catering for congregate and home delivered meals for our seniors. This was submitted to procurement. So we're waiting for this one to be posted also. And then we have our social work case management services, another RFP. This was submitted to procurement. We're waiting for this one to be posted as well. Then we have our heavy duty residential cleaning services for seniors and disabled persons. This is an open solicitation. This is in procurement, waiting for processing, waiting for it to be posted. And finally, for Aging and Disability Services, we have our escorted transportation services for elderly and disabled residents. This one has been submitted to procurement also, and we're waiting for it to be posted. And that is it finally for Aging and Disability Services. I believe our next and final service area is Children, Youth, and Family Services. And they have a number of solicitations. I believe a couple of them are in solicitation. I apologize. A couple of them are in procurement, waiting to be processed, and the rest we're still working on these internally. So the first one is our interagency family preservation services. This is an RFP. Yeah, this one's an RFP. And then the next is our linkages to learning, right? That is an RFP as well. And then we have our post-adoption services. This one, I believe, is one of the ones I mentioned that is in procurement, waiting to be processed. Our next is Seneca Valley. We're still working on that one. And then we have our supply and demand studies, the child care needs. This one this was submitted already to procurement, waiting to be processed. And then our cost of care update study. This is another RFP that we're working on internally. We're looking to get this one out there as soon as possible. And then our final one for the service area is our infant and toddler routines-based interviewer open solicitation. This is brand new for us, and we are still working on this one internally. But again, we hope to have these all posted as soon as we are done with our drafts internally. And I believe those are all of our solicitations that we have either submitted to procurement or working on internally in the pipelines out there. Please, again, my name is IJ Aji, and happy to take your questions if you have any.
Thank you, IJ, for that presentation on Health and Human Services Department. Now we will have a question and answer session. Thank you to all of our attendees who posted your questions in the chat box. We will have a question and answer session now. I'd like to introduce Alicia Jackson. She's our procurement specialist in the Office of Procurement, and she works with HHS contracts. So I will turn it over to Alicia, and she will facilitate the question and answer session. Thank you.
Hello, good morning. Give me 1 minute. Okay, IJ, will there be upcoming communications and outreach needs in support of your programs?
Say that again one more time. Will there be any outreach and communications? Is that what you were saying?
Yes, will there be upcoming communication and outreach needs in support of your programs?
Yeah. So when we have any internal news, updates, anything at all, we make our contract monitors aware so that they can then communicate all of the updates directly to their vendors. And then certainly if any of them have additional questions, they're all welcome to follow up with me directly if need be.
Okay, next question says, how do you solicit equity, diversity, and inclusion training for staff?
So as you know, the county, well, you may not know, but the county has had multiple sessions of equity for us all to be informed, for us all to be aware of our thinking, our processing, the way that we are looking at our contract, our RFP language. So those trainings have been made available to all county staff. And then internally, also within the county, there's been a subcommittee that's been created to review our equity languages across the spectrum for all of our contracts, but even specifically to our RFP terms and conditions and our language. So we're working closely with office of the county attorney's office to ensure that our RFPs moving forward contain language that addresses specifically equity.
Great. Do you have time for any more questions?
I think we have time. We're only at 11:31.
Okay. Let's see. This next one says, can you say more about the interviews-based coach opportunity?
I will have to follow up on that because some of these we would need the subject matter expert to give us a full description of that. So if I have the person who's asking their information to the extent possible where I'm not giving out too much information about that, then I'll be able to share what I'm able to share.
Okay, this next question says, how does the HHS department address EAP needs for their staff?
For our staff, I mean, EAP needs meaning what specifically?
I am not 100% certain.
I mean, if we're referring to the services
for clarification.
Okay.
All right.
Because I'm not sure if this is an HR type of question in terms of needs and supports for our staff.
Okay. I'll move on to the next one.
Okay.
Do you manage inpatient medical facilities? Is there procurement of supplies and equipment also handled through HHS procurement?
I'm sorry, what was that question again, Alicia?
Do you manage inpatient medical facilities? Is there procurement of supplies and equipment also handled through HHS procurement?
Not familiar with that one.
Okay. Do you foresee any telehealth solutions needs?
We have a telehealth solutions now, and I believe we're also working on some of those right now. So yeah.
Okay. And for clarification for that previous one, EAP means Employee Assistant Program. So
I think that is an OHR
related question?
Yes.
All right, then we'll follow up with them privately.
Yeah. But yes, HHS does procure for services and equipment. But the facility part, that one I'm not sure about.
Okay, and then I think this one is just looking for clarification of your chart where it says, I guess, the fiscal year and time expected. It says, does the time expected in your chart refer to the year that services will be for or when the RFP will be posted?
So two things. Some of these services are already existing, and in some cases, we have had to extend these beyond the term because of bandwidth and capacity, either on the procurement side or on the program side. But when we refer to the fiscal year, we're saying that our expectation or our desire would be that these services, the solicitations are made available or effective by July 1st, either of 2022 or 2023. So in those areas where we're saying fiscal year 22 and then fiscal year 23, those are our desired start dates for July 1. We don't manage the hospital's procurement, no. We manage just the county. We manage just the county contracts.
Hmm.
Oh, I think I was talking before.
Yeah, questions are still coming.
Yeah.
So I reached the I guess the end of the questions that we have for now. So anything else we can answer offline, and if you just give us your contact information, we will definitely get back to you.
Sure. If the slide is still up and showing, my phone number is on there, 240-777-3807. And then my email address, the full name is Ijeoma, IJEOMA.OJ, OJI at Montgomery County governmentmd.gov. Montgomery County MD.gov. Sorry. Perfect. Okay.
Thank you. Do we have any more questions, Alicia, from the chat box, or are there any more questions?
That's all for now. I think everything else we should be able to answer offline.
Okay. Well, thank you very much, IJ, for that informative presentation. We certainly appreciate it. And if there are any more questions that our attendees have not had a chance to ask, please type them into the chat box now. We have a couple more minutes that we can remain here and answer some questions, but I don't see any. So I will advance to our last slide. And I want to thank everyone for participating today. Thank you to all of our panelists. Thank you to our staff behind the scenes who are answering chats and responding to questions. And thank you to our production team and on our staff. And I wanted to give the opportunity for anyone in our staff, our procurement staff, who is still on the call. Is there anything else that you wanted to address, or is there any questions that may have come in the chat box that you wanted to answer? I just wanted to give an opportunity now. This is the moment where I say, speak now or forever hold your peace.
I have something to say. This is Grace Denno. I'm one of the division chiefs in the Office of Procurement. Thank you all for participating in our annual procurement fair. We do have a monthly open house that we host on each third Wednesday at 10 a.m. Right now it's virtual. You can find it from our website that is listed right here, www.montgomerycountymd.gov/PRO. On our homepage, you will find the open house link, and then you can join us each Wednesday, each third Wednesday morning at 10 a.m. And I see a lot of questions coming in, and all those questions can be answered in those open houses. So the next one will be in January, and I hope to see you there. Thank you.
Thank you. Thank you, Grace. Does anyone else on our staff have any comments or questions? Anything that we didn't maybe get to today during the presentation? If not, I will conclude our virtual procurement fair. Thank you all for joining us. I want to let you know that this presentation, the PowerPoint presentation, and the video recording of all the sessions will be available on our website, montgomerycountymd.gov/pro. You can find the PowerPoint presentation on the website now. It'll take us maybe a day or so to get the video recordings ready for posting on our website. Please share your experience with us on Twitter at MocoProcure using the hashtag #VirtualProFair. We are also on Facebook and LinkedIn. Please take this short survey. We will post it in the chat box. We really appreciate your participation and we value your feedback greatly. So please take this short survey and help us improve our future events. You will also receive an email with a link to the survey in the next half an hour or so. So with that, I'd like to conclude today's event. Thank you all for participating, and we look forward to seeing you at our next open house in January. Thank you and have a wonderful day.